Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah, assalamu alaikum wa rahmatullahi wa barakatuh. Hope you all well. Today I'm going to talk about ADHD in adults. There's been a lot in the media over recent years regarding ADHD in adults. It's a disorder of childhood characterized by three cluster of symptoms, okay? Inattention, hyperactivity, and impulsivity. And the symptoms should be present before the age of 12. Um, a lot of people have been missed as kids for whatever reason, especially, for example, females, they get missed because they don't present in the stereotypical way of, boys who are disruptive and, causing chaos in the classroom. They often present with mainly inattentive symptoms, and because they're naturally intelligent, they often mask those symptoms, which means that they get missed. So with adult ADHD, I have been doing a lot of assessments, and it is a real thing. There is some people who don't believe in it, but it is a real thing, and it causes a lot of disruption and reduction in quality of life for many people. So when we do an assessment in adults, we identify these three cluster of symptoms, looking at lack of focus or inattention, which often presents with people being forgetful, not being able to retain information, short term misplacing things like their mobile, their keys. When they're having conversations, they often describe like a steam engine in their head, their thoughts racing at 100 miles an hour, which makes it very challenging for them to be attentive during, for example, conversations, during education. Many of the patients I've seen in university or in jobs, and they're unable to complete tasks because they get sidetracked, which frequently results in challenges at work, or people dropping out of university or struggling at university, um, doing things at the last minute, so requiring deadlines to actually complete tasks, which becomes very stressful. So a lot of university students, for example, require multiple extensions for assignments, and people in jobs, high pressure jobs, may be pulled up by their line manager or supervisor because they're not able to, complete tasks in a timely manner, which causes a lot of stress. Time management is also an issue. So people describe time blindness. They're not able to keep track of time when they're doing tasks and are frequently late, for example, to work, which causes stress, obviously. So those are the kind of the inattentive type of symptoms that people report. With the hyperactivity, they often find it difficult to sit still. So, for example, meetings, people, in addition to being distracted, they also have to frequently get up for a drink or go to the bathroom. Um, for university students, they're unable to sit through lectures without, fidgeting, either fidgeting with their hands or actually physically having to get up. Some patients have described it being very painful for them to sit for prolonged periods of time. This is not always the case. So some people don't have the hyperactivity, they have the inattention and the impulsivity. So, for example, if they're sitting to watch a TV program, they're not able to sit throughout because of their hyperactivity. In extreme cases, I've seen people during assessments having to walk around because they can't still sit still for even 5 minutes, and that tracks back to their childhood. So people often describe, being labeled as disruptive. Their school reports parents' evenings being very traumatic. In extreme cases, people actually being excluded from the classroom, which negatively impacts their self-esteem and obviously their education. And then finally, the cluster of symptoms which really do significantly impair people's quality of life is the impulsivity. Now, impulsivity presents in multiple different ways. It can be impulsivity in terms of reckless behavior, such as substance use or promiscuous behavior, multiple partners. It can present as people talking very fast and interrupting during conversations, because when a thought comes in their head, they have to say it straight away, otherwise they'll forget, finishing people's sentences. Being impatient if they're stuck in traffic, or say they go to the supermarket and there's a long queue, they can't tolerate that, they get very frustrated. It can also be where people say things which are socially inappropriate because they don't have a filter and it just comes out, they blurt out whatever comes in their mind. Gambling, sometimes people with severe impulsivity have gambling issues, like I mentioned, substance use issues. So these cluster of symptoms really do affect people's quality of life, interpersonal relationships as well. Um, and there's many patients that I've seen, even during the assessment, they just can't engage for long periods of time, and it really causes reduction in the quality of life. I saw a patient recently, very articulate, very eloquent young lady who had a traumatic childhood because her ADHD was not recognized. She was described as being very impulsive, having mood issues like depression, anxiety, self harming behaviors, and she spent a lot of time with different doctors in child and adolescent mental health, being prescribed various antidepressants, which didn't do anything for her. And so she just went into a very dark place with intrusive thoughts of self harm because she felt that nobody was listening to her. And then over the years, she was also diagnosed with things like borderline personality disorder, which can overlap because of the impulsivity. Anyway, fast forward to now in her 20s, she was assessed and had Bond or ADHD, and she broke down because she reflected on her life experiences and felt that if it had been diagnosed appropriately and she had been treated, it would have saved her a lot of suffering. This is a common theme with patients that we see. The thing about ADHD is we have very, very effective treatment. So these stimulants, okay, stimulants which act on areas of the brain that help reduce the severity of the symptoms I've described, allows people to have more headspace, allows people to actually physically sit and engage in learning if they're in university or at work, and be less impulsive. So it makes a big difference. Within mental health, it's probably the most effective treatment that we have in terms of medication. The effectiveness is around 70 to 80%. If you compare that with with depression, that's more around 20 to 30%. So we have very effective treatment. The medication is a stimulant. We do also have non-stimulants. The main side effects of the stimulants, it can increase your blood pressure, so we monitor that very closely. It can reduce your appetite. And then sleep, it's a mixed profile. It can improve your sleep because usually patients with ADHD have an erratic sleep pattern, so it helps improve their sleep. Sometimes it can disrupt it. And so we titrate from a low dose to a therapeutic dose, and then monitor patients on an annual basis. It's very effective treatment, okay? Now, linking into the impulsivity, as an addiction psychiatrist, we see a lot of patients engaging in substance use, especially using things like crystal meth or cocaine as a means of self medication, because essentially the treatment for ADHD are stimulants. So people, because they've been so impaired, they may fall into substance use with stimulants, which helps them focus more and engage in activities, whether that's education or occupation. And I work with people from the criminal justice system, and it's really noticeable, subhanallah, how much of a difference a diagnosis and treatment makes. So people in the criminal justice system who have untreated and undiagnosed ADHD, they often may engage in kind of reckless behavior that goes into criminality, and they're in and out of the criminal justice system, reoffend. And then when you see those individuals, so I can describe one gentleman in his, I think his late 40s. So he'd been in prison 4 or 5 times, for various different offenses. And when I saw him in hospital after he'd been referred for an ADHD assessment, it was so noticeable that he had ADHD, severe ADHD. He was unable to sit for 2 minutes, walking around, talking very fast, being very impulsive. This affected his ability to have interpersonal relationships, hold down a job, uh, spilled over into criminal activity, and even when he was admitted for substance use treatment, he was unable to engage in group therapy. So after I saw him and diagnosed him with ADHD, started treatment, within a month, actually within 2 weeks, he was a completely different person, unrecognizable. The therapeutic team could not believe the difference it made. And then he was so happy when I saw him for a follow up appointment. He mentioned that his wife said that he's a completely different person. He's actually able to listen and function. And then what was really nice was he was advocating for other people who he thought had similar issues within his family, because there is a kind of a family component where individuals have a higher risk if there is a family member with ADHD, and also other patients on the ward that he felt may have ADHD. So he started asking me to see them. So this was a really nice outcome. So often, when you look at people who are stigmatized with addiction, they may have ADHD, and it's something that's not recognized or is missed. And if it is assessed early and people receive early intervention and treatments, it will save a lot of suffering for the individual and their families, avoid negative consequences, including being in prison, for example. So it's very important to raise awareness of this adult ADHD and to get people assessed and treated. So if some of these symptoms what I've described resonate with you, please get help, get assessed, and get the treatment that you need, because it is life-changing treatment for the vast majority of people. Yeah. So hopefully that was helpful and educational. Keep tuning in and subscribe for more content related to mental health and substance use. Until next time, this is your brother, Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.